Hello, and thank you for joining today's webinar. I'm Ben Evans, your MC for today, and I'm a community relations consultant with Anthem. One of the areas I focus on is you, the Interfaith community partners here in Indiana. We want to thank you for everything you do to bring hope and healing to your community. So I'm thrilled to welcome you to the 4th Annual Interfaith Health and Wellness Summit presented by Anthem. This year we've changed the format to a virtual webinar. In light of the health pandemic, our theme for this year is It Is Well, Serving During a Time of Crisis. As shown on the website, our agenda for today includes a greeting by Dr. Kimberly Roop, representing Anthem, our presenting sponsor. Opening remarks by Dr. Jennifer Sullivan of the Indiana Family and Social Services Administration. A panel discussion with faith leaders on serving during and after a crisis. We will also present our Community Star Award, which highlights a faith-based individual or organization who is impacting the community they serve. Also here on our website, you'll find our speaker bios and other important information. Now, I'd like to introduce Dr. Kimberly Roop, Plan President of Anthem Blue Cross and Blue Shield, Indiana Medicaid. As many of you know, Dr. Roop has been a champion for interfaith partnerships here in Indiana. With that, I'm pleased to welcome Dr. Kimberly Roop.
Welcome to the 4th Annual It Is Well Interfaith Health and Wellness Summit presented by Anthem. We are grateful for our faith-based partners. You're the experts. You have been doing this forever, supporting holistically Hoosiers in mind, body, and in spirit. We know that this has been a really challenging time for you. The needs of our community are greater than ever. Your support is critical, and we want you to know how much we appreciate you. I'd also like to recognize and thank community partners who have also come together and helped to support Hoosiers holistically. I'd like to thank the Center for Interfaith Cooperation, the Family and Social Services Administration, and the Indiana Minority Health Coalition. Here at Anthem, we've taken a page out of your playbook, and over the last several years, we have focused on the whole person. Wellness is not just physical wellness or the absence of illness. Wellness is about absolutely everything that keeps us happy and healthy. We've reached out to more than 20,000 members during this pandemic, and we've learned a lot. We've learned that there's a tremendous amount of depression, isolation, anxiety, and also the need for things like food, things that we simply cannot live without. And in response to what we've learned from our outreach, we have put a number of initiatives in place. And one of those is our partnership with Gleaners. You may have heard of the No One Runs on Empty campaign. This partnership with Gleaners will provide 10 million meals to Hoosiers during this time, something very critical to our communities. Another thing that we're doing here at Anthem is we've provided computers to support telemedicine and virtual learning in our communities. And we've particularly focused on the needs of those Hoosiers experiencing homelessness, those that are victims of domestic violence, and also children in foster care. A big concern of ours is protecting our children, and specifically around childhood vaccinations. Because the pandemic has interrupted the way in which we would typically receive services, fewer children have been vaccinated. We at Anthem are focusing on the importance of childhood vaccinations, the importance of preventive care, and stressing to Hoosiers that we need to keep people protected. We ask for your help in getting this message out so that we can protect our children. Again, I want to thank you for your partnership. We certainly could not do this alone, and enjoy the discussion with our expert panelists today.
Thank you, Dr. Roop, for those comments and all that Anthem is doing to serve Hoosiers during this difficult time. I'd like to echo Dr. Roop's appreciation for our invaluable partners, the Center for Interfaith Cooperation, the Indiana Family and Social Services Administration, and the Indiana Minority Health Coalition. Next, I'd like to introduce you to Dr. Jennifer Sullivan, Secretary of Indiana Family and Social Services Administration. In addition to serving as secretary at FSSA, she continues to work clinically in the Riley Hospital for Children Emergency Department. FSSA is a founding partner with our Interfaith Conference, and we are honored to have their leader, Dr. Sullivan, with us today.
Thank you for joining us today for It Is Well, Serving in Times of Crisis. I'm Dr. Jennifer Sullivan, Secretary of the Indiana Family and Social Services Administration. During this time of crisis, our call to service is louder and more important than ever, and so are our partnerships to care for each other and find a way to deliver hope as well as health. Not too long ago, we had Mr. Sam Odell talk to us about how to focus our energy on the long-term solutions for poverty that have become even more obvious during the COVID pandemic and broader understanding of the impact of racism on health. He said that we have 7 things to work on. He called them the 7 building blocks to defeat poverty. 1, affordable, safe housing. 2, reliable, affordable, balanced nutrition. 3, a basic level of financial resources, livable wage. Those things include transportation and internet access. Number 4, affordable, accessible healthcare. Number 5, a network to support us to manage the bumps in the road, the social capital or friends to help us through the hard times. Number 6, a spiritual base or moral code that includes civic awareness so that we are all knit together. And number 7, quality education and adult skills like lifelong learning. Faith-based organizations play an important role in each of these 7 things in the community, especially during times of crises. With issues affecting our country, many people are reaching out to faith-based organizations for spiritual refuge, support, and assistance. Often, individuals will turn to their place of worship when faced with major illness, physical and mental, homelessness, hunger, addiction, abuse, unemployment, and other issues. Faith-based organizations serve as powerful vehicles for social, economic, and political change. Faith-based organizations are part of the permanent fabric of our communities. During these challenging times, I would like to thank our faith leaders for their continued commitment and daily efforts to help improve the health and wellness of our communities. The compassion and tireless efforts of faith-based leaders are appreciated and do not go unnoticed. The mission of faith-based organizations and Anthem are both aligned and focused on improving the health and wellness of underserved communities. From my own youth, I remember a powerful song that was derived from Deuteronomy 31, verse 6. It said, "Be strong and courageous. Do not be afraid or terrified because of them, for the Lord your God goes with you. He will never leave you nor forsake you." From whatever your faith or spiritual journey may be, we must all be willing to be a constant in each other's lives so that we do not have to be afraid or terrified. During the webinar today, we will hear from several faith leaders as they share how they have been able to serve their communities during and after a crisis. Thank you.
Thank you, Dr. Sullivan. Now I'll turn it over to Brian Cobb, our moderator for today's panel discussion. Brian and I work together, and he serves as a community relations manager for Anthem Medicaid. Brian?
Well, thank you, Ben. Thank you, Ben. I'm going to get started and take off my mask, but thank you all for being here in this wonderful panel discussion. So I want to introduce our panelists for this time together. To my left, I have Pastor J. Philip Carroll, and you are the pastor of the Greater Shepherd Missionary Baptist Church. Welcome to this discussion.
Thank you.
And we also have Father Rick Ginther. Father Rick Ginther, welcome. You are the pastor of Our Lady of Lourdes Catholic Church, so welcome to this panel discussion. Then we also have Dr. Anita Joshi, and you are the community liaison for the Hindu Temple of Central Indiana. Welcome to you as well. And last but not least, we have Pastor Evan Bever, who is the senior minister of First Baptist Church of Indianapolis. Welcome to all of you for being here and being a part of this discussion. So let's get right to it. I have lots of good questions, and I know the conversation is going to go well. I'll start by asking you, Dr. Joshi, there's so much going on right now in our world, and certainly in our country, in our state, and definitely in our city with COVID-19. And my question to you would be, is how have you collaborated with others to address the health and wellness of the members of your organization and your community?
So
As a physician, I think I have the privilege and the burden of being someone that is turned to by the community oftentimes, and there are many members of our community who happen to be in the medical profession, who are physicians, and I think we have looked to the science and the medical advice that's coming from, reputable federal agencies like the CDC and Dr. Fauci and people that we want to hear from who can give us, the information that we can then translate to our congregations and our communities. So at the beginning of this, the Hindu temple, because it's a working, living, breathing building on a daily basis, had to kind of come up with some interesting protocols, and we worked with the medical task force to do that, to try to follow the science and as well as keep the community safe, but keep some connection within the community.
Mm-hmm. Thank you for that. Well, Pastor Carol, certainly as a fellow African American, the African American community has really suffered strongly from COVID-19. How have you dealt with and collaborated with members in your community to address the health and wellness aspects?
Well, we've been quite blessed at Greater Shepherd to be able to partner with OptumServe, which is the agency that the state health department has also partnered with to provide testing at our facility. So since May 19th, we've been from Monday through Fridays, we provide testing for the community free of charge. We average anywhere from 80 to 130 people per day. Kind of slowed down a little bit September, but towards the end of September, it started picking back up when the numbers started going back up. So we've been very fortunate to be able to provide that service for the community. And also in that, we also provide resources for them to get the other issues that they may have. We're able to provide them with the resources that they need, whether it's diabetes, whether it's food, whatever it is that they need when they come, then we're able to help provide that. Yeah.
Thank you for that.
Mm-hmm.
There's just so much going on within the community, in the faith community. And Father Ginther, allow me to ask you, there's so many changes going on within our churches. And what have you done differently to provide spiritual leadership to the members of your church and your organization?
Well, after mid-March, it became quite a challenge. The first thing we did was to begin videotaping, if you will, our Sunday service, because we were not allowed to be in the church. I could have 10 people, including myself. So we would videotape that on Saturday and then air it on Sunday after it was all edited out. And eventually we were able to live stream, which has been a very great gift for us to be able to continue to share our worship each week. We have also spent a great deal of time communicating with our parishioners through our Friday newsletter, which goes out through Flocknote, with our Facebook platform, and with our bulletin, which also is available online. We reached out to all of our elderly folks a certain age and up and made sure that they had a contact person, either from the family or we would give them one from the parish to check in on them. And we had a long period where there was no worship services, public worship services. There were no weddings, there were no baptisms, there were no funerals. That was a very hard thing for the people and a great challenge for us to provide what we could and what was allowed. Now that's opened back up, but even still, a lot of social distancing, pews roped off, only so many people per pew, and it's still quite the challenge. Mm-hmm. Happily, because we can live stream, we've live streamed weddings, we've live streamed funerals, baptisms, so that people who can't come, who are more heavily affected, could be there. So those are some of the things that we've done other than preaching and teaching, et cetera.
Mm-hmm. Pastor Bever, I would ask you the same. What have you done differently, with the spiritual leadership of members of your community and church?
I think our experience was a lot like the experience in other congregations, some of what we've already heard, which was by March 15th, I think we had stopped gathering in person. And certainly by the end of March, we knew that this was a long-term situation and we needed to figure out how to worship together, how to learn together, how to take care of one another when we couldn't be together in person. Like a lot of congregations, we turned to live streaming to continue worshiping together. But one of our major emphases during those early months was that we were worshiping at home. So our staff, our pastors, our musicians, we all started recording video and live streaming from our houses. We didn't even go to the sanctuary to make videos or to live stream. We tried, especially in the early months, to avoid any groups at all. So if you could record something at home by yourself, that was the best way to do it. What I think worked really well about that, at least for us, was we weren't just taking our old worship services and streaming them into people's houses. We were designing a completely new way to worship together. A lot of the things looked the same. We were still saying prayers together, singing together. There was still a sermon, but we were designing those things to be done at home. So we were creating a long-form worship guide each week that could be used along with our live stream, but we had links to pre-recorded videos so that people could use it whenever they got around to it. If they didn't want to wake up for a 10 a.m. live stream, they could do it later on Sunday, they could do it Wednesday night, whenever it was. And I think that was something different and helpful that we did for our congregation. One of our really high values at First Baptist is learning together. So one of the other things we had to figure out how to do during the spring was faith formation. We had always done that in person. And suddenly we were trying to use Zoom, we were trying to use Facebook Live to organize small groups, to organize book studies and Bible studies, to keep doing the prayer gatherings and the learning that we were already doing, and to add new things to it. We started doing Sunday afternoon check-in Zoom chats, just because we knew that people needed a chance, especially in the early weeks, to talk to each other and to process what they were going through. Probably, I don't know if it was the hardest thing, but a persistent challenge through all of that was communicating. How do you let people know what you're doing this week? How do you communicate your long-term plans? Our e-newsletters had to change. We had to send a lot more communication. We know that some people still don't check their email every day. A few of our members still don't have email addresses at all. So we were constantly communicating something and then asking, how do we reach that last segment of the congregation who haven't heard this yet?
I love the creativity that you both shared. One of the difficulties, of course, the creativity is the life events. So now weddings and funerals are a lot different for the community. So, Pastor Carol, allow me to ask you, how have you been able to conduct these life events differently in light of everything that's going on?
Well, just like Pastor just said, or Father actually said, was regarding life events, funerals and weddings and things. We've done them live stream. We've done some that was in person, but we had to limit the number of people that could come, and then everybody had to wear masks and just had to make the various adjustments that was necessary in order for things to go off. There's been a lot of live stream, and I know that a lot of people now are tired of Zoom and tired of Facebook Live and all. I mean, and they want to see each other, they want to be together, but you still just have to make the necessary adjustments so everybody can be safe. And so that's what we've done is regarding weddings, funerals, and other events that may have happened. We can't even go to it's unusual that we can't even go to a hospital to visit members when they go in. And so you just make that adjustment and try to FaceTime or do different things in that way, video chat, something in order to make it happen, so they can know that you're thinking of them, that you're with them, even in those instances. So you just make the necessary adjustments, and all this was new to all of us as pastors and leaders across the world. And so for many of us, we don't do videos, we don't do the live. We wasn't doing it before now, but it was something that more or less we were forced to make the necessary change. And so we've done it what was necessary, and now I know for me personally, I've gotten a lot more comfortable doing it. At first I was very uncomfortable, but as we kept going week by week, because it wasn't going away, so you just had to do what you needed to do. So I thank God for that.
Yes. Yes, Father Ginther.
If I can add one thing, at one of the funerals that we had, it really wasn't a funeral, it was a burial at Calvary Cemetery. The father of 5 children, his widow was standing there. The 5 children and the widow, the grandsons and daughters carried the casket to the grave, and then they had to go back to their cars. And one of the children stood there with her phone, and it became the point to broadcast to all the other phones.
Oh, wow.
Of all the family members in the cars, so that they could hear what we were saying at the graveside. I was stunned by that. I'd never thought of that possibility.
Yeah.
And then I shared that with other families as we were doing that. If you want to do that, it's okay.
Yeah.
So at least they can share, because we were only allowed 10 people at the graveside at that point in time.
Gotcha. So how were you able to maintain the specialness of the experience for people?
By being with them and by being very personal about what their need was, admitting of the awkwardness of the situation, and yet promising something later. And we always promised that if they wished to, we could have a memorial mass later when we could open the church back up. And of the 6 burials like that, 3 did have memorial masses and 3 chose not to. But we offered, and if they came back in another year and said, now we'd like to have it, we'll do it.
Interesting. You know, with what you just described, there's so many who are hurting and dealing with the depression and the mental health situations. And Dr. Joshi, I'd like to ask you, what have you done differently to provide care and counseling to members of your community and your organization?
Yeah, I think we have definitely availed ourselves of Zoom and Facebook Live and all of the other, opportunities to, get community members together at difficult moments, because people need support when they're going through, death, loss, when they're going through birth of a child, when things are, changing or not going well, when they can't see their grandparents who are far away. I think making sure that we have the opportunity with the temple to connect to our members on a regular basis. A Hindu temple is a daily service that's done, and the priests have been able to go into the temple and conduct their daily rituals, which actually provide a lot of comfort to people who are isolated at home at times. And so I think being able to live stream those daily, being able to provide daily connection points for the community has been very helpful. And then recognizing that this is a time of great anxiety for all of us, and that we need to be balanced within ourselves. So being able to conduct things like yoga classes and meditation classes and classes that we would normally do live at the Hindu temple in ways that we can allow many people, not just people necessarily who are associated with the Hindu community, but any community, to participate in those ways to find balance and breathing and calmness. Because I think if we can't have that within ourselves, it's very hard to hold the community together with that. So we've had to learn how to do that for us, and then how to share that with the community at large and bring people in to experience those moments of balance.
Yes, wonderful. Pastor Beverly, I'd ask you the same. You've done so much to make the worship experience great, and what you've shared, even with the forum that you shared about. How have you been able to provide care and counseling to those with all these options to consider?
I think by far this has been the most challenging thing for us. It's been a time of so much tension and anxiety, exactly when we needed to be around people, to be able to sit in a room and share, to be able to go through our rituals, not just the words, but the way we always do them. Like, that's what makes a ritual work, is that you do it the same way every time. So to have this period of so much disruption and so much isolation, and to not really, I would say we didn't know how to provide the kind of care we normally would. When we couldn't visit people in the hospitals, when we knew they couldn't even visit their loved ones in the hospitals. I know many families, or several families, at least in our community, that lost loved ones during this time, chose to postpone funeral services or memorial services, and still haven't kind of finished that part of the process. Those rituals provide some closure and some healing, and to just put them off indefinitely, that compounds the grief, I think. And we've seen a lot of that. I would say early on, I realized that when I was making phone calls, I needed to schedule more time. Phone calls that used to take 10 minutes, or I could count on somebody just letting it go to voicemail, and I would just leave a 45-second message saying, just checking in. Those calls were getting picked up, and people had a lot to talk about. They were meaningful, rich conversations, but I imagine a lot of pastors like me found that they had to build more time into their schedule just to talk to people. And that's probably the thing that we've done, other than trying to provide as much of the normal programming, structure, ritual as we can. It's been talking to people one-on-one and giving people space to talk to one another.
It's interesting what you just shared, because it led into another question I had, and I was going to address that to you, Father Ginther, about staying in touch with members in your community, young and old. And of course, Pastor Carol, you mentioned about people being tired of Zoom, but some of our older population may not necessarily have Zoom to utilize. Mm-hmm. So how have you kept in touch with some of your older population as well as your young population?
It's been one of our biggest challenges. We do have a number of our older folks who do at least have Facebook, and that they also have access to our flock note so that they can see the newsletter, et cetera, or the bulletin online. But reaching out to them, we relied to a certain extent on their families. First of all, that's part of what we did with those phone calls, to find out that they were connected to the families and the families knew to connect to us. So it was kind of, we were working together with them. Some of the others, we found it difficult to even get to reach, because go to voicemail, no response. The younger ones were easier because they were all over all the electronic media. And the school, we have a school at Our Lady of Lourdes, we were also constantly in contact with them through an awful lot of Zoom, Facebook, and we even taped some of the school masses. And then, so that when we came to the end of the school year, we were trying to feed them spiritually to the extent that we could at a distance. And we were told that was helpful. That's the biggest challenge, though, is staying in touch. And we have about 1,800 people in the parish, and that's a relatively small Catholic parish. The bigger ones, like 5,000 households, I don't know how they've done it.
It's hard. I think the bigger, the congregations are tough. And I think a challenge for us in the Hindu community is that there are a lot of people who are immigrants to the United States and who have family members that are still in India. And we've had a lot of losses where, normally we would be able to, get people together and find a way to get them back to their home country to at least visit with their relatives. And now that's impossible to do for many people. And so that's been a huge challenge for people who aren't who might not have anybody else to support them in the community. So having to step into those spaces and connect with them and make sure that they're okay,
Right.
and making those extra phone calls has been, it's been challenging. It's been really tough for people.
Yeah. What about the African American community, Pastor Carroll? How's that been for yourself, working with the young and the old?
What we've done is we've been very fortunate. In March, when we saw that it'll be a while before that we come back together, my team and I, we immediately went into a Zoom meeting and started sketching out how we're going to keep everybody connected. And so we call them the Silver Seniors. We have a Silver Seniors director, and she and I and the group, we decided to make sure that all of our seniors were connected. So she did that, putting that together. And then I have a youth director, and he did his part to make sure our youth stay connected. And so monthly, he has a Zoom call with the youth, and then my Silver Seniors director, she makes sure that they have everything that she goes and pass out. Her and some of her people go and pass out grab bags with different necessities in it for the seniors, checking up on them. I was talking to one of my seniors yesterday, that was Tuesday, and just to check on them, I make sure I get a call in at least every 2 weeks. And while talking to her, she said that her tablet went out, but she was blessed enough to get in touch with another senior while the service was going on, and she was able to hear the service through somebody else's phone, and so she was able to stay connected, and how much she appreciated how the effort that's being made to make sure that they don't lose out or get left behind. And so that's what we've made an extra effort. I think that during this season, during this time that this is the most I've pastored in my 22 years of pastoring because the connection has to be there, the different assignments that God has given me regarding the seniors, even the young adults. They want to make sure they're not left behind, and so it's just been a great time for me I feel closer to everybody now, that even though they're not in the building yet, I've talked to some that I haven't talked to in 5 years that they've been in the church, besides speaking and saying, hey, how you doing? But now I feel more connected to them than ever before. So, yeah.
Interesting. All of you have shared so much that you're doing in your organizations and the new efficiency. So might I ask you, Pastor Bever, do you feel like they've made you more effective in ministering to your church?
It's a great question. I've joked that when this is all over, we're back to normal, whatever. I'm never going to another in-person committee meeting in my life. And it's not a joke. Like, I laugh after I say it, but really the capacity to meet virtually, meetings that used to happen in person where 8 to 12 people would all have to drive to the church building on a weeknight, take time away from their families, beyond just what we needed for the business that we are doing as a congregation or the plans we're making. I really think we've all learned that we don't have to do that. Some of these things can be handled remotely. Obviously, we're still going to have some in-person meetings and some in-person programming for sure. But I think we've realized that this technology can make our lives easier. That's probably the biggest thing that we've noticed or realized as far as our congregational life and how we administer that life. Certainly we've learned to use the technology more effectively, both for programming, live streaming services. We'll almost certainly continue to do that after this is all over. Some programming will still happen online because people want to be a part of it, but don't have time to get to the building. Our staff, I think, has also learned to communicate more effectively even when we're not in the building together. So we've been working from home, or we've been working with a few staff members in the building. So we're doing a lot more written communication. We're doing a lot more check-in using video conferencing software and things like that. And I think those things have made our lives certainly easier during this period, but will continue to be really effective and helpful.
Dr. Joshi, how about in the Hindu community? Have you seen these efficiencies be a positive effect?
Oh, I think people appreciate not having 3-hour meetings that drag on and on. So I don't disagree with you. I think there are several people who do not want to do committee meetings in person. They would like to do their programming and services and get-togethers and celebrations in person. But the meeting stuff, I think they're very happy to move aside. It's been interesting because there's so much of what happens at the Hindu temple also involves, like in many congregations, food and eating, and that's been something people are missing, I think. So very much looking forward to getting the kitchen back up and running. So I think we found some really nice ways to streamline, I think, some work for the cooks and to make that easier during this time. So I hope that that'll be fun for us. But I think we've also learned that we can do more with less than we thought we could. It's amazing. I think that we've seen that, and that I certainly have been able to attend more medical conferences and webinars, and probably because I've needed to, with the changing information. But it's also been possible to do them if you can do them from your office, right, or from your home, and not take that time away from your families, or not take that time away from your congregants that you need to pastor to, and just be able to do the stuff that needs to get done in a more efficient way. So,
Yes.
yeah.
Wonderful. Well, one thing that I will say, certainly in a church experience or a worship experience, is music. Some things, people just get moved by music. And Pastor Carol, I know you and your experience of being a worship leader in church for some years, how's that effect been to your church? What are you doing differently for your worship experience? And how have you adapted to the new social distancing needs in that experience, and even the online aspects?
Yeah.
How's that been for your congregants?
It took some adjusting. It took some weeks for us to get it right. We struggled the first couple of weeks with my band and singers, trying to figure out how to do the social distance, but yet, because let me just back up, because our service, even since March when we first closed down, yet my band and 3 or 4 of my singers will still come and meet to provide service, and then just do the Facebook Live and the YouTube Live and whatever streaming software we have, the other different live streaming. And so we were just trying to figure out, it took a couple of weeks for us to really get it down, changing the scene, changing the environment, making sure that the band was safe. The band was wearing masks. The singers were 6 feet apart, or we had to make sure how we staged them. And just so it doesn't get boring, or boring looking, we had to change the scene every now and then and put them in different places in the congregation, just to change it up a little bit. But the music, my minister of music and the team, my music team, they did a incredible job making the adjustments to make sure that while people were tuning in and coming in on the live stream, that they were still getting engaged and getting involved, and people were responding while the singing and the music was going on, saying how much they enjoyed it, saying, just responding as if they were in the service. And so that really meant a lot. It was hard at first because, once again, this is new to all of us. And just trying to make those different adjustments was kind of painful at first, especially when you go back and watch and hear, especially being a musician, I was a music minister for almost 20 years, and in different cities. And so just to go back and hear it, it was really kind of painful sometimes, my eyes cringing, and really felt like chalkboard scratching. Just making those adjustments, because my singers was nervous. They was like, this is going live. Wait a minute, I don't have my part, going on YouTube, wait a minute, so it was just, everybody had to get used to it.
Yes.
So, but now they're used to it, so.
I know, Pastor Bever, you guys have been very creative at your church. How's that music worship experience been?
Music is tough because you can't sing together on Zoom. At least you couldn't last spring when we tried it. And the value was not only, we value in our worship services not only having beautiful performances and hearing people sing beautiful music, and we've been blessed with really incredible musicians, but the thing we value most is singing together, right?
Yeah.
Not just listening to beautiful music. So our minister of music can record beautiful pieces on the piano, and he does, and it's easy to upload those, to include those in a live stream. What's so much harder is to actually encourage people to sing along. And we've tried to do that. We've made sure the lyrics are there and available. We've tried to sing songs that are familiar, that can be sung alone. But what's meaningful about singing together in church is singing together in church. And even though you know other people are singing, you feel like you're singing alone at your house, or it's just your family singing alone. So I think there's something about the music in worship, at least for us, that cannot be replaced. We've substituted for it, and we've tried to do that in a way that's meaningful and invites participation. And we have heard beautiful music, and we've sung along with beautiful music this summer. But in a lot of ways, we know it's a substitution, and we are looking forward to and longing for the day when we'll actually be back together in a sanctuary, and it will be safe to take off the masks and sing.
Yes.
We're sort of in a hybrid at Our Lady of Lourdes, as in a number of the Catholic churches, because we've been open for public worship since June the 14th. But it's been scaled back, especially the music. We aren't singing as much. We have masks on. There's no choir, because there's no way in our building to distance them. Our folk ensemble has been inactive since March because of the same reason. Our musician is an absolutely stellar pianist and organist, so he produces some really fine music, which we can live stream. And those who are able to be present, they do sing. It's taken them a while to get used to singing through a mask, but they've gotten the knack of it because the church is getting fuller and fuller with the sound. But I was just at my brother-in-law's house up in Illinois for a family gathering, and on Sunday morning, since I was there, we watched what they were doing at my church back in Indianapolis. Just because that's what my sister and brother-in-law do on Sunday mornings now. They can't get to church because of their age, so they watch their brother. It was amazing. My brother-in-law is sitting there singing along and telling me, this is hard. I can say, I can tell it's hard. So there is this hybrid going on. You've got people at home who are singing along, and they're praying the creed together, and they're doing everything that we would do normally. And yet, we're struggling to welcome them in, and they can't be present for whatever reason.
Yeah.
So it's this, thank you for doing this every week for us, and yet at the same time, we really want to be back there, but we don't want to be back there. We want to sing, and the folk ensemble's just like this, and the choir is so sad, and we're looking at Christmas without a choir, and they're crushed. So it's been tough, but we do what we can within the parameters that we've been given for vocal production in the church.
Yes. Well, obviously, so many have had to adjust to this new norm, a new way of life. And allow me to shift to a more sensitive topic. So much is going on in our world. And Father Ginther, I'll talk to you again. But as a faith leader, how have you been dealing with addressing the issues of social justice?
That's been a real challenge because as a pastor, you walk the tightrope of, that in your congregation on the social justice issues, you have people on the whole spectrum, whether they are for, against, or indifferent. My major focus has been to guide them towards what is the issue, okay, and what do you know about it? What are your sources? Are they reputable sources? And is what you're doing with it, is it simply anger or expression of that? And where does that fit into the gospel? And where are you connecting with the human need that is being expressed in these very social issues? Giving them the stuff they need to process and to take it to their prayer and compare their reaction to the gospel and what the Roman Catholic Church teaches in terms of various social justice and morality, and give it over to them and encourage them and say, please, you need to work on this. I can't do it for you, but I will do it with you. Like I say, it's a trick bag, because you're walking a fine line of trying to keep everybody civil in their discourse and in their thoughts, so that they will focus on the common good and not just react.
Yes.
And guide them to, here's some resources. I've preached, I've written, the Friday newsletter, the bulletin letter, Facebook. We just keep doing a piece each week on some issue.
Yeah.
So.
Pastor Carroll, how has it been in your experience so far? Because it's such a sensitive topic. It's a lightning rod.
Yeah, it is. Being an African American that pastors a African American church, predominantly African American church, this has been a hard time for us. But my thing as a leader is to model what Jesus said in regards to loving thy neighbor as you love thyself, and expressing that to our congregation constantly, and not just in words, but also by example. I have taught a couple of times just from this year alone, with all the different issues that has come to surface. Just this year alone, I have taught a couple of times the parable about the Good Samaritan that Jesus taught in regards to how to treat somebody that's considered an outsider, that's considered a nobody, and all of that. And this is the thing that we must continue to teach one another, is learning how to express our differences without actually hating one another. And this is the example that Jesus taught. And so in dealing with this is teaching the congregation, and especially our young people. We have to have the conversation with our young people about not walking around hating, not walking around treating people wrong, or because they're different, but learning how to just love everybody. Easier said than done when you're put against a wall as so much and so often, but yet you still have to continue to try to do what you can to love as much as you can.
Yeah. Mm-hmm. Such a first.
Yeah, I think, for us, I think in the Hindu community, it's been really interesting because social justice really goes back to some of the core roots of Hinduism in and of itself, right? The principle of namaste, that I bow to the divine in you, that's also in me. I see the divinity within all humans, and I must be able to acknowledge and celebrate that divinity. And I think the youth have been great at leading these discussions in the Hindu community about, wanting to be involved very much in the process. I think a lot of so I'm born and raised here in the United States, but many Hindu Americans were born and raised elsewhere and emigrated to the United States. I think immigrants sometimes feel that they are afraid to get involved. They kind of hide. It's not that they don't want to be out there in the street protesting, they feel it. We come from a culture of Gandhi, right? Nonviolent protest is not alien to the Indian culture. And yet, if you're an immigrant in a new country, you sometimes just don't want to be seen. And so you'd rather not, but the youth are not having any of that. And so they are out there. And so it has been a wonderful experience, I think, for me as sort of that in-between person to say, okay, the kids want to go down, we want to get involved, we want to do something, I'll go. We're going to be safe. We're going to do this right. We're going to do this with respect. We're going to do this with kindness. But we're going to be involved because they think it's important. And so that's been the balancing act to have. And so it's been the challenge, but it's been, I think it's been a good one. And I really think if we look to the youth, they are definitely going to lead this movement in every way, whether it's Black Lives Matter, or whether it's, climate change, or, whatever it is, they are the ones leading, so.
Mr. Beverly, you had a smile on your face, something popped in your head.
It's just inspiring to hear and to have seen through the summer young people from all these different communities taking the lead, refusing to be silent about what's going on around the country, around the world. It's been inspiring at First Baptist Church as well to see our congregation wrestle with the current events this summer and respond to them. At times, as a pastor of a predominantly white congregation in Indiana, I have felt like I was walking that tightrope, although our congregation is probably more progressive, less conservative than a lot of Baptist churches in this area would be. We were, even before the killing of George Floyd and the protests that followed it, our pastors, we had already decided to focus on the theme of justice for the summer. So we didn't have to shift direction in that way. But I think we did make a pretty conscious decision that if we were walking on a tightrope, we were going to step off and make sure we stepped to the right side, that we were at least going to challenge the congregation and make it clear where we stood as pastors. And it has been, is still incredible to see how the congregation responded. I think this has been an issue kind of simmering in our congregation for years. People are certainly aware of racial injustice, but probably haven't felt a burning need to do something about it or even to learn much more about it. But this year we had members of every generation in our congregation saying, we need to talk more about this. We need to learn more about it. I think that's where we've started, and we'll spend a lot of time thinking together, talking together, watching the documentaries, reading the books, making sure we're hearing the voices, especially from the African American community. But our mission and outreach team this summer formed a new task force for racial justice. They chose the name for it. And they will be thinking not only about what we can learn, but they've already begun to think about what we can do as far as building relationships and fostering justice in Indianapolis. And also, they're thinking about what can we give? How can we use our financial resources, our budget, our mission dollars to support the organizations, especially in Indianapolis, that are doing the grassroots work of advocating for more just systems, more just communities. We've always believed that that's what God wants, that that's what it means to be a follower of Jesus, is to work for a better, more just world for all God's people. But it's been, I guess I would say the word inspiring again, encouraging as a pastor to see so many members of our congregation picking up that ball and running with it.
That's good. Thank you all so much for the work that you do. You know, obviously there's so many faith leaders that are in our community that are just challenged and struggling. So I would open this up to all of you as our final question. What can you share with faith leaders, you know, who are currently watching this panel discussion to encourage them in leading during times of crisis? I see you nodding your head, Pastor Carol. I'll let you go first.
During this time, it's going to take a lot of prayer. It's going to take a lot of being open to change. I've had some friends, pastors, who more or less bucked up against the whole COVID-19 and didn't want to believe that it was that serious and all of that, but did not want to adjust to live streaming and the different changes that pastoring and churches must make in order to be relevant and be effective. But speaking to all leaders, you have to be willing to change. You can't be in analog while the rest of the world is in digital. So you must be willing to make whatever adjustments you need to make for your congregation and for your team in order for it to thrive and survive for later generations. That was the problem with Blockbuster videos, was that Blockbuster is no longer in business because they weren't willing to change from videotape and you must rewind. And so now they're irrelevant. And so now we're in a whole different time, and Redbox came and took over, and now we're doing live streaming. So you got to just make whatever adjustments you have to make for your congregation in order to be effective and to be relevant.
Yeah.
So that's pretty much all I have to say for leaders.
Yes. Anyone else?
Well, I agree. I think change is inevitable, right? We're going to always have to change and evolve and continue.
Right.
And you know, time is cyclical, right? We're working on that idea that things are going to keep evolving, keep moving forward. And so I think we have to move with them. I also think, though, that we have to take time when we're working with communities to find the balance in ourselves and to sort of be able to calm ourselves, take that time for ourselves so that we can fill up enough so that we can give and serve, because you need that time to be able to whatever practice it is that you use to find that balance. But I think it is important to do it so that you can give more to the congregation, because the needs are great right now and the needs are going to continue to be great. And no, this is not going away anytime soon. I'm sorry to say that, but I think it is going to be here for a little while, and we simply need to evolve with it.
Yes.
One of the things I've experienced through the Irvington Association of Ministers, through the CIC board, through other groups of ministers and pastors that I get to deal with, is all of us have talked about how this has affected what we're capable of doing, but also how has it affected us internally and spiritually and even physically. And sharing that has been extremely helpful, so that I know with the Archdiocese of Indianapolis, with our priests, there is a Zoom call now once a month just for them to talk with each other if they've got the time and they can gather in on this, just to share what's going on in your parish, how are you feeling, what are your challenges, what are your successes, and what are your questions. I think this is one of those moments when we draw better together and grow better together and not isolate ourselves. Although we are isolated, but we are blessed to live in this time with all of these means by which to communicate.
Yeah.
I can't imagine this 20 years ago. This would have been like the wheels came off, but the wheels have not come off. So I have been happy to be able to unburden and to receive from other ministers and other people in ministry.
That's it.
To other faith leaders, to other pastors, to people leading in congregations, I would say what I say to myself at least 4 times a week, which is breathe, take a deep breath. It's almost fun to sit here on this stage and talk about all the things we've done this year that have worked. Obviously, I'm not going to sit here and share about the things we tried that didn't work or the things I just didn't get around to doing because this has been hard. This is still hard. All of us, just like you've said, are dealing with not only our professional responsibilities and congregations where everything is up in the air and flipped around. We're trying to figure out how to lead congregations in a completely new world while we're also trying to care for ourselves and our families. I know I'm not saying anything people don't know, but it has been incredibly important for me to verbally remind myself multiple times a week that it's okay if things aren't perfect, to stop comparing my ministry to what a colleague is doing or what the church down the street is doing, to know that we have to figure out what works for us, what we're capable of. I think we will be surprised to learn we're capable of more than we thought, but only if we take care of one another and take care of ourselves.
Excellent. Well, allow me to just say to all of you, thank you for the work that you're doing. You are making a difference, and I appreciate that you're out in the community reaching so many because you're necessary during this time. So I want to thank you all for being a part of this panel discussion. You were a blessing, and we wish you the best in all of your ministries and much success.
Thank you very much.
Thank you.
Wow, what an important discussion. Thank you to all our panelists for their insights, sharing the many ways they've been able to continue serving during this crisis, and for their advice on how to create and support a healthy and well community. As in past summits, we would like to recognize a faith-based organization that has demonstrated continual service to their community. This year, we are honoring an organization that has served young men in South Bend and Mishawaka. For over 30 years, Heroes Camp has ministered to young men to develop their spirit, soul, and body, providing mentoring, guidance, education, support, physical exercise, and music and arts programs. The young men are encouraged to model leadership and expected behaviors of respect, integrity, leadership, and honor. The success of the program is evident in how the young men who age out of the program return to volunteer and serve in the program. I am pleased to have Tiffany Etter, Medicaid Plan Marketing at Anthem, and Tony Gillespie, Vice President of Public Policy and Engagement at Indiana Minority Health Coalition, to present the It Is Well Community Star Award to Pat and BJ Magley, the founders of Heroes Camp.
On behalf of Anthem Blue Cross and Blue Shield, we're so excited to present you with this check for $1,000 for the great work and service and ministry that you're providing to your community, not only for their physical health and well-being, but for their emotional and spiritual well-being. We're very grateful, and I know you've got a grateful community as well.
On behalf of all the young boys that we serve at Heroes Camp, thank you, Anthem, and thank you for remembering what really is important, the lives of these young boys. Amen. We really appreciate it.
Amen. Congratulations to Heroes Camp, and thank you to Pat and BJ Magley for your service to young men. Anthem recognizes that faith-based organizations are trusted entities, providing spiritual refuge and a place of hope and help during good times and challenging times. Faith-based organizations continue to lift up Hoosier communities, and Anthem is here to support your health and wellness initiatives that are helping to improve your community. This year, it gives me great pleasure to announce that Anthem is launching the 2020 Interfaith Health and Wellness Grant. The grant will provide financial assistance to faith-based organizations that implement a health and wellness program serving their faith organization or local community. Grants are limited and will be selected based on criteria listed in the application. The deadline for submission is December 1st, 2020. You will find the application on the interfaithsummit.com website. So please, complete the application form by the deadline. Well, that brings our webinar to an end today. Thank you all for joining us. We encourage you to implement a wellness initiative in your organization and community. Continue your important work. You make such an impact on your community. Before we log off, I want to let you know that we have some upcoming workshops you may be interested in attending. Information about these events can be found on our website at interfaithsummit.com. One you might want to check out is the Home Safe Home Workshop on Tuesday, November 10th, 2020, from 11 o'clock a.m. to 12 o'clock p.m. This workshop will be facilitated by Terry Stigdon, Director of Indiana Department of Child Services. Thank you again for joining us today. May you walk in peace and bring everlasting hope to those in need.